It is Tuesday, April 14th, and we've got another Burlington COVID-19 update for you. Thank you for joining in on Zoom. Sorry we're having trouble with Facebook again. It's part of the delay getting started here. But we got a good update to share with you, and thank you for tuning in. The main topic I was wanting to discuss today is about the COVID-19 recovery site, which is a new facility, a new piece of infrastructure for our battle against the coronavirus. And it is a piece of infrastructure, a new facility that is open and operational as of yesterday at about 3 o'clock. And the first thing I want to do is congratulate and really thank everyone who has been involved in this huge lift of bringing this new facility into existence. You know, this is not something that there's any direct precedent for. There's no roadmap for it. It has involved a lot of work on a short time frame and involved many partners. I specifically want to thank CBOEO, and in a moment we're going to hear from their executive director, Jan Demers, who's going to join us. But it's been a team effort that also has included the Community Health Center of Burlington is playing an important medical role at this facility, and many different agencies and individuals within the state of Vermont have worked really hard to make this happen. So again, thank you. This is just as there was work through the holiday weekend to bring this into opening yesterday, and a lot of people have been taking on new roles and efforts to make this work for weeks, including our own City Councilor Brian Pine, who actually called into the City Council meeting last night from the new facility. He is one of the managers making this happen. So again, thank you to everyone for this important new facility here. The city's role in this is as is typically the case in this, we're generally not responsible for public health. We're not responsible for social services. In this case, however, given the importance of this effort to our to the response to coronavirus, it is something that the city and I personally have been very focused on and working very hard on. I called publicly for the creation of this facility about 3 weeks ago, and monitored basically virtually daily in communications with the state as this was being developed, and really have tried to work, and I think this will continue to involve additional effort, tried to work with the state to ensure that we don't just have this physical facility and this capacity, but the mechanism, process by which people are referred to the site and are admitted into the site is worked out, so that individuals can be notified and made aware of this being an opportunity for them. I think this is a facility that will have immediate use today. For example, as people are aware that there has been testing going on at Decker Towers for the possibility of a Saturday that was someone self-reported there, and so many other people have been tested over the last couple of days. The thought has been that that might be a site that if someone tested positive, there may be some reasons why they might want to choose to isolate at this Holiday Inn site, this COVID-19 recovery site instead. So there's an immediate urgent need for this. I also think, and one of the reasons I've been so focused on it is, from my perspective, we're going to be in this battle against coronavirus for many months. And I think this facility as a place that people is going to play an important role throughout the time that we are battling this virus. Maybe it's not, maybe it is the site, maybe it's a site like it, but something like a place like this where is going to be necessary. So what am I talking about here? What is this facility? And I want to define it and speak to it in some specifics, because there have been some misconceptions, or not even misconceptions, but there's been some evolution to exactly what we're talking about here. And I'm going to lay out my understanding today about what this site is and who it's serving. And I'm going to say that while acknowledging that, like many things in this crisis, we're doing something new, we're doing something without precedent. It's happening, there's urgency, it has to happen very quickly, and things shift over time. And so what I described here may ultimately, there may be expanded or change evolution. But here's what it is today as we understand it in our conversations with the state. First of all, this is a facility that has really two big purposes, in the sense that two big public health purposes. One is that it's going to serve people who cannot effectively self-isolate, to ensure that two things. One, they receive the proper care and they are healing from this infection, and to protect others in their house situation from being infected. Essentially, this is supposed to serve people who cannot effectively self-isolate because they are homeless, or because they are in a supportive housing environment that involves some group facilities, and where they will be challenged to safely and effectively self-isolate. This is for COVID-19 positive individuals who either have no symptoms or low-level symptoms. Currently envisioned as a site where people are going to get significant, serious medical care. Sort of a spectrum of what people need when they are experiencing coronavirus, when they're recovering from an infection. There are some people who need to be the most severe symptoms. Then there is a middle group that doesn't require hospitalization, but is quite sick and needs a lot of support, has a hard time caring for themselves. Like the least, some people call it the tier 1 group that has the least amount of symptoms, maybe doesn't even have any symptoms at all, isolate themselves so that they are not infecting others. This facility, at least for now, is envisioned as serving that first tier, the tier that does not need a significant level of medical care. How do people end up at this facility? There are really two ways that people can get referred here at this point, and I think I want to sort of describe a little bit about the way this system is working in Vermont, because I think it's, it is a system that has a certain amount of decentralization and a certain amount of centralization, and both of those elements are kind of brought to bear to try to ensure that the right people are made aware of this opportunity and go here and go to this Holiday Inn facility. People can be referred here through their primary care provider. So if someone is concerned that they have the virus, and they call their doctor and they get tested, those test results will come back through the doctor, and the doctor then hopefully will go through a conversation with their patient and establish whether or not they can safely self-isolate. And if they can't, we'll make the person aware of this facility and the possibility of recovering there. In addition, every time someone is on, the State Department of Health has what they refer to as this EPI team, which is responsible for contact tracing, that quickly follow up with everyone who tests positive, and also start to talk through the circumstances that COVID positive individual is facing. And if the EPI team becomes aware that they're isolating in their home where they're living, they also can refer and help get this person offered the opportunity of staying in this recovery center site. So I wanted to share that. This is all new and it's evolving. And as you can hear, it is important that everyone who has a role here in Chittenden County in the provision of medical care, that providers are aware of this. And so the Department of Health and the state is making providers aware of this. But I also wanted to use this opportunity, which this platform where we're communicating about the virus in real time, to make sure the word is getting out to primary care providers that this facility is open and that it can serve people who cannot effectively self-isolate. I guess I want to be specific that what do we mean by supportive housing environments? So there are numerous different buildings here in Burlington run by affordable housing nonprofits that provide supportive housing, and that in many cases provide supportive housing for medically older or otherwise sort of medically vulnerable populations. The city has been working to try to compile a comprehensive list of those facilities here in Burlington and provide them to the state, so that the state, in its notification efforts, is able to ensure that when someone tests positive in one of these buildings, the opportunity to house at the recovery center is advised to them, and that patient is made aware of this. So that's essentially how people end up there now. It is because they test positive and they are living in one of these supportive housing facilities, or alternatively, if the person is known to be homeless and can't self-isolate for that reason. That is a group that this is very much geared towards this facility as well. I think that does raise lots of questions that have not been fully sorted out. So there may well be buildings outside of the city of Burlington that are similar in nature to similar supportive housing environments. And I think in the days ahead, if there are managers of buildings outside of Burlington and you're interested in this service, you can contact CVOEO, you could contact the city, you could contact the Department of Health, and you could get added to the list. And, you know, in addition to that, I think something on my mind and that we are, you know, we're less, you know, we're basically like a month into this. If there are other people who aren't living in supportive housing, but are struggling to properly self-isolate because of the type of household that they live in, and they live with older family members, they live in a situation with other members of the household, and self-isolating at the home is challenging, and you need help. We want to know you need help. That would be a reason that we, you know, if you're having a challenge, you don't feel like the system is supporting you properly through this, we want to hear about it. Call the recovery, the Resource and Recovery Center. This is the Burlington facility that we talk about pretty much every day on this briefing. The Burlington Resource and Recovery Center. You can find the contact information right on the City of Burlington homepage, and we may be able to help you in some way. I think that's what I wanted to share about this facility. And now I'm hoping we've got the technology right and we can bring in Jan Demers now, who is the Executive Director for CBOEO and who has been a just great partner to the city. I must say, throughout my 8 years as mayor, and I know for many years before that as well, time and again, when there is a need in this community that no one knows how to address, Jan puts up her hand, CBOEO steps forward and gets that need addressed. She did that back 5-6 years ago now, I think, with the creation of a low barrier shelter in Burlington. We had never had a facility like that until Jan stepped forward and operated it the first winter, and in a very similar circumstance here, when it became clear we needed a facility like this to serve vulnerable populations. It wasn't clear whose job this should be. Jan stepped forward and said CBOEO will fill the need. So Jan, thank you for getting this site operational, and welcome.
Thank you. I don't know, as you said, you've said so many important things when you started this conversation. I want to highlight several. First, to say that the Burlington Resource Center is a great resource for everyone to find out things where they have questions and don't know where to go. So that's been a solid help for us. And then just before we get into the Chittenden Recovery Center, I also want to thank the city because so many efforts have been just strained to the ultimate limit. Some of our food supply, and the city has stepped up with masks for the food shelf. They have stepped up with thermometers that we're actually using in the recovery center. And everywhere we turn, we've got support that's solid right from the city of Burlington. The recovery center did open last night, and we have our first guest. It's somewhat of a soft opening. This week we are, as the mayor has said, we're flying the airplane while we're building it, but we've got a solid base to build that. Brian Pine and Liz Curry have stepped up with leadership that is unbelievable, and the state of Vermont has been with us and leading the way from day one. The medical center has been so supportive in so many different areas. And we've even gotten some help from outside the city. We've got someone that's coming to bring some N95 masks from Morrisville today, who heard about the recovery center. So it is a place, and what I like to say is it's a small COVID, small COVID, big recovery. It is for people who, as the mayor has aptly said, are homeless and have no place to go, or just are not safe. And and can take care of themselves, have minor symptoms, but nevertheless are certainly positive and are able to spread the disease to others. And that's why it's so very important that people are isolated and that they're able to recover with the supports that they need. I want to lift up the staff at the recovery center. If you can imagine, for the city of Burlington, but for any kind of organization to be able to hire 15 to 20 people in a 2-week period and do all the background checks and do all of the reference checks and talk to people, it's a major effort, and we have a phenomenal staff. People with healthcare backgrounds, people with social work backgrounds. We even have an epidemiologist who was in the Peace Corps. We have people who are passionate about caring for their neighbors, that are willing to don personal protective equipment and look like they're heading into space. Only they're heading into the space of the need of another person that's in the room before them. They're going to have wellness checks several times a day. There will be telemedicine, and we're going to be working again, as the mayor said, with the Community Health Center of Burlington, and also perhaps a new partner with UVM Home Health and Hospice. So there's support that's here, and also people who have expertise that are standing beside us, behind us, and leading the way in front of us. You've given an awful lot of information, sir. So many of the criteria you've named quite clearly, and the referring agencies, and coming through the physicians, personal physicians, or different agencies, and they can call an intake line. I do have that number.
Oh, great.
Area code 802. And this is for agencies, it's not for individuals to call, but if there's a physician's office, or if there's someone that needs to know and wants to see about if the person that they're caring for is eligible or is appropriate, it's 802-241-0457. And I also wanted to let you know that today, all day long, there have been people that have been working up documents that give frequently asked questions. So you'll have even more information for tomorrow. That should be done by the end of the day, and we'll make sure that we get that out early tomorrow, so that Excellent. People have a solid base on which, because in these days, there's so much that is swirling around that brings fear. We don't want to bring fear. We want to bring fact and help.
Jen, that's, wow, very powerfully said. Poetic, almost, your analogy to going into space. Thank you. Again, I'm so great. Well, I'm glad to hear about the intake number for institutions. That's great. We'll make sure that that's highlighted on the Burlington web pages, so if people come through us, they'll be able to find that. What is the current thinking, Jan, about how many people you expect to serve here? How many is the maximum that you feel you could serve there? Is that all figured out?
Well, I hope we don't get any more than 2, but we're getting more today. That's just an unanswered question. I think Burlington and the state of Vermont have done such a phenomenal job at getting people to stay at home and to take the precautions that they need, that I hope that every room that we have will not be needed. We can have probably close to 150 rooms. I'm hoping we won't need even a third of those. But every precaution is being made to make sure that we're as ready as we can be for every eventuality. And the eventualities are brought up by the minute. I was at the center yesterday, and I would describe it as purposeful chaos. Very purposeful. There's one person in one corner that's looking at the ventilation, and there's another person in another corner that's making sure the safe is what we call cold, warm, or hot. This is going to be a cold, soft, safe place for the people who work here. This is going to be a warm place where there'll be some viral exposure, and this is going to be a hot place where there will be definite exposure. So people are looking at IT, they're looking at all the supplies, making sure that there's going to be food, making sure that everything that's needed by the people that are going to be our guests will have before them. So there's an awful lot of work that was done yesterday, way into the night, and then today as well. But things get clearer hour by hour. As I say, we'll have a frequently asked questions document that's going to be done by the end of the day today, and it's going well.
Great. Well, excellent. Jen, is there, I'm aware you've got a ton to do, and I don't want to hold you up but anything else you want to share at this point? And don't feel like you have to share. We're going to have you back. We're keeping this briefing going. I think we're going to keep doing this as long as it's helpful for getting information out during this emergency. We're in this stay home posture. We know now into May, halfway into May. So we'll definitely bring you back for an update in a few days. But is there anything else that you'd like to share now?
No, I just think that there are multiple people who have great wisdom, and I'm glad that it's focused on this this pandemic, so that we will be able to keep as well as we can. And that's my wish for you and for the people who work with you. Thank you.
Great. Jan, thank you so much. Good luck to you. And Jan, I hope you think of the City of Burlington as a resource. If something unexpected comes up, I hope you know you can reach out for help to the City of Burlington.
I have to say yes, I already have. I mean, the people in your office have been incredible. As I say, we didn't have any thermometers. We have two. We have more from the state now, but we didn't have any. And we called, and the folks that were working with you were able to provide us with the things that we needed. And so thank you.
Great. Excellent. All right. Good luck. We'll talk to you again soon.
Thank you.
Okay. We have a few other short topics that we wanted to basically updates we wanted to share with people. We've talked before frequently about various aspects of the effort to support people experiencing homelessness during this emergency. Again, in the update we just heard about, this COVID-19 Recovery Center is one of those efforts. The North Beach Campground RV facility is another effort. The largest one is really the state expanding its hotel voucher program. And I think we shared maybe on yesterday's briefing that there are actually now 350 people who have vouchers and are living in Chittenden County hotels during this crisis. And I think that's, it's just a sign of how, I'm very appreciative of that and what that says about the state and their commitment to making sure that everyone has a home during this crisis that requires people to stay home and stay safe. The program was extended. Was what I wanted to share here is that I had not heard this confirmed until just today. These vouchers now will be extended for the duration of the stay-at-home order through May 15th. Yeah, again, an important kind of comprehensive effort by the state to address a real need. Couple of issues with respect to mental health that I wanted to share. I think as we settle in some ways to the stay-home posture, knowing that we have weeks ahead, we all need to be mindful of how challenging this is and the toll that this can take in a variety of ways on people's mental health. And I wanted to share a couple of resources for the public to be aware of, to service tools of sorts as people are trying to navigate their way through this challenge. So first of all, we have a few more details on this town hall meeting on mental health and addiction that the city is helping to sponsor. It's going to happen this Thursday at noon. This is the town hall meeting we announced towards the end of last week. Excuse me. Here's the panelists up on the screen. You can see there will be 5 panelists that will each come at this question from a different perspective. Richard Bernstein, the chief of psychiatry at University of Vermont Medical Center, Gary DeCarlis, our great partner to the city, executive director of the Turning Point Center, so involved in the regional effort to fight the opioid addiction fight, and the Turning Point Center is involved in giving people supports if they're battling all sorts of addictions. Gary will be part of this. Grace Keller, who runs the Safe Recovery Program, the needle exchange that has become this outstanding place for people to access medically assisted treatment as well over the last year and a half. Grace will be joining us. Jackie Corbley, who is the city's opioid policy manager. She works out of the Burlington Police Department. She's been with the city since late 2016, a position we created to fight the opioid epidemic. Jackie will be part of this panel. And then finally, Anthony Jackson Miller, who also works for the city as part of the city's Community Justice Center, a parallel justice specialist, will be, I believe, moderating the event. That's the quick summary. More information soon will be up on the city website, burlingtonbt.gov resources. And also wanted to mention a UVM webinar. And of course, the town hall meeting is a webinar too. So the UVM webinar is on supporting mental health of children and young adults. Will be happening tomorrow at noon. And there's the link. If you can jot that down, we'll also make sure that is posted on the city's webpage, at the Resource Center webpage. This is a really serious issue. I'm one of my friends, I know in their community, not in Burlington, but in the region, there have been some, there was a recent suicide, and I think it's a time where we really have to be looking out for the mental health of our children and young adults. And thank you to UVM for making available this resource for people to engage that topic. Finally, we wanted to close, and we're going to try to do this every day as we continue these briefings and bring attention to to one of the many new cultural resources that the city is making available online to help Burlingtonians and really anyone who wants to access them make it through this challenging stay-home posture. Tomorrow, the BCA, Burlington City Arts, our great city arts department, is premiering its first ever interactive online artist program. And this is one of a number of new online resources. We had Doreen Kraft, the executive director of BCA, on last week to, I think, kind of talk from a big picture about all of the online resources available through the Burlington City Arts. This is one of those. So this first ever interactive online artist program, the artist talk is going to be given by local artist Este Puerta, and it's an exhibition called Sore Mouth Swore, and let me make sure I've got this right, Olivia. So the information is available now. It's right there on your screen, but you can also go to the burlingtoncityarts.org website to get the actual kind of Zoom login number. And that event is happening on April 15th, which is tomorrow at 2 p.m. Did I get it all there, Olivia?
Yes, that is all right.
All right, excellent. that is our briefing for today. Unless there are any questions, anyone online that has any questions about the Recovery Center or anything else?
Let me just pull these questions up. Our first question is from Aiden Quigley at VT Digger. His question is, do you have an update on the results of the testing at Decker Tower?
I don't have comprehensive results to share. I know the state is working very hard on it, and they are there are 2 days of testing, and they want to be completely accurate and sure about their announcement. So we have been in touch with them this morning and know that they are working on that. I did see one person who's been tweeting at me, resident of the site, through the last few days as the testing has been going on, tweeted that he had come back negative, and so it does sound. We'll just share that some people are starting to hear about their results. I think the state wants to make sure that all the individuals know about their results before there's some type of public announcement of it. But I know the state is working hard on it and is eager to get the results out as soon as they can.
Those are, that's the only question we have from members of the media today. One other quick update I will just share for information about that UVM webinar that the mayor mentioned. People also can find that at go.uvm.edu/webinar, and some other resources available there too, or in the UVM online calendar.
Great, thanks again to UVM for that important service. And so that webinar again is tomorrow. Thursday is the city webinar on mental health, and particularly with respect to addiction. And also it's worth mentioning, tomorrow morning we will have the weekly coffee starting at 9 o'clock. You can go to the mayor's office official Facebook page for a link to that, and I hope you'll join us there. And I think those are the announcements for today. Thanks everybody for tuning in. Stay safe. We'll see you soon. Done there.